So I think it's highly relevant for them to seek care at a NORD center, at an established center for rare diseases. And the centers cover the entire United States. I would always, we have families reach out, for example, from Texas, and I would always, ask the families, before you travel to Boston, have you considered going to Baylor? I mean, what differs? How does Boston Children's differ from Texas Children's, for example, with regards to your condition? And frequently, the care is very balanced between the different institutions. We may have an open trial for Niemann-Pick type C. Then, of course, we would like to have that individual patient up in Boston, but likewise, there might be an open trial for another condition that's open at Texas Children's. Then, we would also tell families in Boston to travel to Texas Children's, for example. So I think the families should always seek care at a specialized center who has knowledge and expertise on a particular condition. And then that center can always refer out if there are other centers that I call super specialized with clinical trials, ongoing clinical trials in that particular disease arena. Families should also reach out, and I always encourage families, if there's an existing patient advocacy group on that particular condition. These advocacy groups, they are very powerful. They add a very powerful voice to the rare disease community, and they focus obviously on families and patients. And their perspective is complementary to the clinician's perspective, but it's an important aspect. So families should always reach out to them as well. And they may have their own advice. They may say, oh, you may want to consider going to that center. You may want to consider going to that center.